Hello and welcome to Wellness Wednesdays. I'm Dr. Stephen Ramos, Associate Medical Director with HealthTexas Primary Care Doctors. And every week we're going to bring you a video with special guests discussing important health topics. All right, today I have a really special guest with us today, Dr. Kristi Clark, our President and CEO of HealthTexas Medical Group. Kristi, thank you for joining us.
Absolutely. It's good to see you, Dr. Ramos.
So let's talk about HealthTexas as a group. What really makes HealthTexas special in San Antonio?
Lots of things,
Good.
But I think that most importantly, HealthTexas Medical Group, now we call it HealthTexas Primary Care Doctors because that's what we are, we're primary care, has been around for more than 25 years, about 27 years, and initially founded by 4 physicians, including Dr. Richard Reyna and Dr. Roland Reyna. And important about that is they were both internists who knew the value of having a physician who drives your care. As people age, as they might get with more specialists or more medical problems, it becomes much more complicated to navigate through the healthcare system. Furthermore, when a patient has multiple medical problems, they might have multiple specialists and everyone starts different medications, and it was important to Dr. Reyna and both Dr. Reyna's and HealthTexas that we as primary care are the drivers of that. Communicating with the specialists, but mostly making sure that all of the right people are talking. Everyone's on the same sheet of music, so to speak. And so that everyone who's participating in the patient's care knows exactly what each other member of that team is doing. And that becomes very, very important, especially as a person ages.
So I think those are a lot of really good points, and this is a really special group with a lot of mentorship, to be honest. For you, it included, me joining this group about 5 years ago, teaching us how to be a good navigator, so-called the captain of the ship, and making sure that we understand that we're responsible for the health and the well-being of a lot of our patients and a lot of the people in the city, and how to direct that, and not just prescribing the right medications, not just, making sure they get the right diagnoses and treatment, but making sure that their whole wellness and everything is taken care of as far as can they get to their appointments, can they afford their medications, do they have a lot of other questions that they need answered? Can they get their next meal? And I think that's something that we as a group do exceptionally well, is taking care of that whole patient. We really take responsibility from it. And one thing I can say with a lot of our senior doctors and leadership is being able to translate that to a lot of our new providers and new doctors that come into the group on how to do that and how to do it properly. I think it's an incredible, valuable thing that HealthTexas offers to this community. And so with discussion about, different insurances and care and so forth, managed care, and what does that necessarily mean for a lot of our Medicare patients, and how has HealthTexas, how do we do that better than maybe some others?
I think that when we talk about managed care, so first of all, managed care has made full circle. Back in the 80s, managed care was kind of a no-no word. No one wanted to talk about managed care. What's happened through the years, though, is managed care simply means that you are providing care, just like we talked about earlier, with one person as the primary focus, with one person as the information gatherer, etc. When a medical group like HealthTexas is used to working with insurance plans like this, what we call Medicare Advantage plans, they become very adept, just like we are, at doing that. We see a lot of patients with those insurances. Hence, we have our own diabetic educators. We have our own hospital teams. We have our own case management. So a lot of the infrastructure that you wouldn't necessarily have as a medical group if you weren't seeing Medicare Advantage patients is already there. And that really gives the patient a much better outcome. And like you said earlier, the physicians that choose to work with HealthTexas, we really like being that go-to person. In fact, we love it. And, we've had physicians here and there who that's not their cup of tea, and they move on. But for those of us that have been doing this for a long time, we love being the doc that our patient calls. They may have 4 specialists, but they're going to call their primary care doctor when they really are wanting to let someone know where they are in the emergency room, because they know we have all those records and we have their overall care right in mind.
Yeah, I think that's a great thing and something that's really important, of being able to have that one person where if you have any question about your health whatsoever, I know who to call. I call my primary care doctor. They're going to be able to answer that question for me, even if it was something the cardiologist said or their other specialists, or whether they need to go to an ER or not, they know exactly who to call to get that answer. Right. It's something it's great, and yeah, we enjoy it.
Sometimes a patient specialist, I'm sure you have the same kind of experiences. The patient will come and say, you know what, Dr. Clark, I saw the cardiologist, but he didn't tell me anything. And I'm sure that they do tell them something, but they may not spend the time that we do. They may not be focused on, okay, I'm going to make sure that my patient understands everything that happened to him or her and what our pathway is going forward. And that is a privilege to really have the time. I think that most of us spend time with our patients because you really have to in order to drive that care. And that's the real privilege, is really to develop that relationship with your patient through years.
Yeah. And I think that the way things are moving as far as healthcare as a whole in this nation is, geared towards more quality rather than quantity.
Right.
So how do you feel like HealthTexas is going to be moving forward into that picture?
That's what's so beautiful. We are perfectly poised. We've basically been doing and performing quality healthcare since before it was really popular. And now most people are noticing that in other words, in the only way to really save money and to really give the patient the treatments they need, the right time, the right place, really is to have a well-orchestrated system. So, a lot of medical groups that previously were not practicing in the Medicare Advantage space are now wanting to move into that because many patients, in fact, more than 45% now, have chosen to pick a Medicare Advantage plan, basically saying, you know what, I'm going to let go of my Medicare and let a private insurance company run that, whether it's United or Humana or different kinds of programs, but basically letting someone else run that coverage for them and navigate that system. And so when you have a medical group like HealthTexas that is very good at doing that, it's a win-win.
Yeah, it's really something I think that's important, going forward and sustaining the model and the quality of the healthcare that we have is cost is something to think about. Whether it's, our patients affording the care that they're getting and, globally or nationally, making sure that we can afford to continue this process and keep people healthy. And I think we have a really good model of ensuring that you're still getting high quality care,
Absolutely.
But without any frivolous or extra spending that's just unnecessary. No unneeded testing or unneeded visit with another specialist or going to the hospital frequently when it's something that can be taken care of quite easily with your primary care doctor. And I think
especially when primary docs like HealthTexas have a lot of ancillary services. You may not have to go and see the specialist for every little thing. A lot of times, things that you and I can do in the offices or for perhaps one of our APCs, things like procedures, minor surgical procedures, EKGs, echoes. There's a lot of benefit in being in a Medicare Advantage plan and having kind of everything under your doc's roof, if you will.
Yeah. And it's another good point about our group that is important to bring up and talk about. But as far as having our APCs and nurse practitioners and others that help us as doctors, manage our patients better, how does HealthTexas do that differently?
I think we have spent a long time with the team approach and also with relationship building. So we have a very wonderful group of specialists that have worked with HealthTexas, most of these folks, for many, many years. And not only are they wonderful specialists, they also know what we as HealthTexas physicians like in their care. They know they want to send us a consult note. They know they want to keep us in check with what our patients are doing. They know that we want to be able to tell the patient, hey, here's what's happening, and not be scrambling for records. That is, I think, something that we have spent many, many years building. And in turn, I think we've also developed a relationship of providing quality care, which is why physicians themselves refer patients to us, emergency rooms, and we've been around a long time, and most of us, we've worked in the hospitals, we've worked with folks in the community for years, and they know that our primary goal is delivering top quality care, and that most of us are in it for the long haul, and we really love practicing primary care.
Yeah. And this may be reiterating a lot of points that we've already hit on, but say we have somebody who doesn't have a primary care doctor and they're looking for that new place to go, and maybe they have avoided, they don't want to go to the big machine or the big groups and are looking for more of a smaller group. How, now with HealthTexas getting pretty large and expanding a little bit, what would you tell to them to say, you know what, the bigger group is maybe sometimes better for you?
I think absolutely a bigger group is better for people because I think you have more resources. Not only, you and I are limited by how many patients we can see a day. we have partners, we have our, we have our extended colleagues, and, your patient may see you or me 10 times in a year, but maybe they're seeing one of our partners the other times. Furthermore, we have different clinics. So, we have Saturday clinics, so we have a lot of availability that a smaller medical group might not have because they may be a shop with, 2, 3, 4 docs, and that's hard to get all that coverage. I think that it's also important that as a medical group and as CEO, I've been very careful about this, that we are growing very methodically. We haven't grown just for the sake of growing. We've never opened a clinic in an area where we don't know that we're going to benefit the patient. We want to go into a community where there is a true need for us. We don't go into a community just to see patients, just to open up an urgent care or just to have people come in we really are looking for long established care relationships with our patients. And that's every community we go into. So I think that and because of that, we pride ourselves that we do things a little bit differently than other groups. We don't have 10-minute appointments. We take time to be able to have a long enough time to spend the extra few minutes you need really honing the situation and knowing all of those, as you mentioned, all of the other superfluous things that are going on with the patient. And I think that's very important. And when you're in a smaller practice, sometimes you don't have the time to do that because you got to pay the bills and you got to keep it going. Whereas we can kind of work on a bit of scale, which I think benefits the patient ultimately. And physicians, they have more fun practicing when they're not constantly on a hamster wheel.
Yeah, not having to worry about all the background or overhead and administrative stuff and just being able to take care of patients. It does make the job a lot easier.
And then there's those of us that are docs that like worrying about that, and we leave that to us, and the rest of us, they can go and practice medicine or what else they decide to do with their time. But the patient ultimately benefits.
And so looking at, serving San Antonio as a whole and taking care of our community, we have a lot of locations spread around throughout the city, but I think, like you said, very strategically located to where we can do the most benefit for our city. And so something recently over the last couple of years is taking a lot of clinics, opening up new clinics, but really not in a different location, but just kind of expanding in that one area to get a little bit more access and bring in some new providers so that we can continue to grow in that single community. Going forward with San Antonio growing as well, any strategy or hint into where things are going to be moving forward for HealthTexas?
Well, HealthTexas, we're already starting to break ground on in the Northeast Corridor in Schertz, actually, which I think will be a hugely successful clinic. There's a great need out there, no doubt. We have Perrin Vital and we have a New Braunfels, but this will be our first office area in Schertz. And I think going forward, our next goal, we'd love to see something in the northeast part of San Antonio, maybe closer to 281 and 1604, and then ultimately south, a little bit south towards Poteet, Jordanton, closer areas like that. So those are kind of in the works.
Yeah.
Looking for the right locations.
I think a lot of room to grow. And then how about looking for new doctors? What are we seeking out as a group when we're looking to bring on new providers and new doctors into the group? What kind of characteristics can people expect when they come and see HealthTexas for the first time? What can they expect to see in those doctors?
And that's a great question. And in doing this now for a good 20, 22 years, it becomes very important which physicians we pick. We want to pick a physician that truly loves primary care. We're not looking for a physician that's looking to get out of the room as fast as he or she can, give the person a referral and send them on and help, and not really helping them navigate the system, but giving them a list of tests and a list of other doctors they have to go see, and not really addressing the reasons or the situation they came in for. So although we love a physician who is established and very knowledgeable, however, there's a lot of brand new physicians. The training is great, and they just need time to practice and get experience with their patients. And so I think that we take a combination of docs. We take some docs that are well established in practice and just looking to join a group and have really the passion for care. And then we also take newbies that are well trained, and a lot of these new physicians, they're superbly trained, and all they need now is the experience and being able to be in a large group where they have the resources and also the time and the colleagues to bounce things off each other and really become very honed at their practice.
Yeah, I think that's great. I think the diversity of our group is something that's really impressive that you don't really see in a lot of primary care groups. And For instance, we have some docs that do really well with weight loss, diabetes, very specific nuances where I can pick up the phone and say, hey, Doc so-and-so, please help me out here. Or, hey, you mind seeing this patient for me and talking with them? We need some help. And keeping that all within house, I think, makes patients feel very comfortable and they feel like they're being well taken care of. And I think, again, another thing that just sets this group apart from the others in San Antonio. Thank you for joining us for Wellness Wednesday. Again, I'm Dr. Stephen Ramos with HealthTexas Primary Care Doctors. If you have any questions or want to reach out to us, our phone number is 210-731-4800, or you can visit us on our website at healthtexastexas.org.